Delaware remains in the grips of an opioid epidemic that is ruining lives, shattering families, and wreaking havoc on our criminal justice system. Just last week, the U.S. Center for Disease Control revealed that of 22 reporting states, Delaware had the largest percentage increase in fentanyl-related overdose deaths in the country in 2016. Over the last 2 years, the state has taken some important steps to better combat this epidemic. Much stricter controls have been put in place on the prescription of opioids. Laws passed earlier this year with the help of several people in this room are going to help break down insurance and Medicaid barriers to getting people treatment. Thanks to the hard work of advocates like Don and Jean Keister, many first responders are now carrying naloxone, which can be used to resuscitate overdose victims. But much more needs to be done. Here at the Department of Justice, we've been vocal in advocating for these and other reforms because this epidemic is a human tragedy, a public health crisis, and a disaster for the criminal justice system. It is time for Delaware to spend money on this problem in a way that reflects the fact that the opioid epidemic is killing Delawareans at a record rate. It is our #1 cause of accidental death. Dealing with it should be a priority in our state's budget. For starters, Delaware must invest real dollars in expanding and improving its treatment programs for those addicted to opiates.
None of us want to be here today, and I think all of us are tired of talking at and about the opioid epidemic. I am eager to stand arm in arm with all of you, but most importantly with our community. And as we work through the Behavioral Health Consortium, the Prescription Action, the Action Addiction Committee that we formulated, we have to be arm in arm, and we're going to have to tackle this together and to look at long-term and short-term solutions.
We do have a great deal of work to do. I quote the statistic that overdose is the largest cause of death in this country for people under 50 years old. I compare it to the kind of treatment that cancer gets, and it's not there yet. But thankfully, we have a state that is interested in carrying on and doing things to help this epidemic, which is absolutely terrible. You know, I lost my son in 2012 to an overdose, and when that happens, you say to yourself, what can I do to try to help others to make this issue go away? And believe me, sometimes I feel like I'm walking in mud, but we are making strides, and I really need to thank the state for that.